So hello guys and welcome back to my channel Guide to Glory. So in this video we have along with us Miss Jagruti Berwa and she is going to tell us about what all to do in dermatology clinical postings. So Jagruti, first of all tell us how was your experience of dermatology wards?
All right, so I'm going to share my experience from Government Medical College in Baroda. The dermatology department here is pretty strict, like not in the matters of examination, but yeah, during the attendance procedure and how well you are attending the classes, like if you are present or not. The very next thing is uh, yeah, they are very punctual. So yeah, the latecomers have to make sure that they be on time. They don't even allow even if you are like a minute or two. The other thing is they have basically it was a good experience. They used to teach. If you are going to ask questions, they are going to answer. It's not like now you read yourself. And even if they say or even if they give you questions now, you can always search in your mobile, so it stays in your memory. Yeah, these two things. And apart from that, they conduct lectures or half an hour, 1 hour from 9 to 9:30 on 10 o'clock. And after that, you have to attend the clinicals in half group. Like the 30 students would be grouped into 15 students, and for 1 hour, the first batch could attend, and the other batch could attend for the later half an hour. And if you wish to stay longer, then after 12, they conduct particular procedures at times. So if you want to observe it, you are most welcome. Yeah,
Okay, so
this
she
was
told an important point that certain procedures might be occurring late. So you need to get aware of those. Like if you know it, then you need to stay there if you want to see. And if you already know it, then you should be staying there so that you could see those procedures.
yeah. And
So
residents
Jagruti,
are going to teach you. Yeah.
okay, so that's the thing that if you wait, then they will not just tell you to just see, they will also teach you. So it will be a learning experience. So tell us more about what type of clinical cases do you tend to see during dermatology clinical posting, or rather, I should say, what a student should see when he has that clinical posting.
Okay, so whenever you are trying out a new subject, the most important thing is you first learn the basics and then you go for more advanced or rare things. All right. So initially, dermatology is a very new subject for you. So in the second year, it's important that you know what is the morphology of the lesions. They are going to teach you, like there are 5 to 6 lecture schedules starting from basics of the skin, appendages of the skin, then what are the skin regions, primary, secondary, specialized. In specialized, they are going to teach about agglutinations, burrows, comedons, any primary lesions also, differences between papules, patches, macules, nodules, plaques, bullae, vesicles. And this bullae and vesicles is kind of important in your pathology thing. And yeah, you can correlate subjects. Then there is another PPT on bacterial skin infections. Then there is on viral skin infections, fungal skin infections, and then there is one more PPT on scabies and pediculosis. Apart from that, they take you to the wards, which is like in front of neurosurgery department. They have a leprosy ward and normal dermatology wards. So you are going to be taken there even in third year because there is NLO basically. So DLO, yeah, leprosy office.
Yes.
So they are going to tell you what all the government is providing. It's a minor lecture over there, 30 to 45 minutes on one of the days. And also in the wards, you are going to see rare cases like we saw Stevenson Johnson syndrome, SJS, and there were patients of leprosy. We saw how they were given splints for those claw and deformity. Yeah. And apart from that, even during our clinical postings, on our last day, somehow we saw this patient. She was a very old, uh, yeah, she was very old, probably from slum area, and she had a lesion uh, on her stomach basically. So that was her only complaint, even though she had a claw and even and yeah, she had a tube. But and you just see, you just have a look at the patient and you know that yeah, she has some problem. So when she was taken inside the examination room, the ma'am checked, and yeah, she found out that there were lesions even on her back. She didn't realize that they were there, and based on clinical diagnosis, she was most probably a multibacillary was the type. But yeah, they took the slide and that was kept. We didn't know more about it. Like the resident called her senior resident, they even called AP just to confirm that particular thing. कि हाँ ये leprosy का ही case है.
Oh,
Yeah, that was the thing.
so
Apart from that,
yes,
ये
so
देखा था.
you kind of get to see rare cases also if you have patience and if you wait.
Yeah. Then the most common case that you are going to see is tinea cruris, and tinea corporis. And you have to know this. You have to know how to describe that particular lesion, at least at the end of your wards, because they are going to ask you. And if you are in the wards, if you are in it for 1 to 2 days, the resident will take you to the examination room, and then they will ask you, okay, describe the lesion. What is. So you have to say it, and then they will teach you further. That is the thing.
Okay.
And yeah, I remember it is a 2 week posting only. So in the second week, basically, yeah, one of the residents asked me, like, the patient was kind of talking too much, and I'm kind of got irritated because of the rest. So she was like, just go inside the examination room and check if it is tinea cruris, and then let me know. So I was like, yay, I'm getting an opportunity. I was the only one there. And yeah, I took her and I was like, yeah, ma'am, it's senior cruise. She kind of checked later, but yeah. So you get to do these things. Then the other cases, your acne vulgaris. Then we have psoriasis. If you attend wards, you can actually see all those patches. And even like the lesions are more prominent on the extensor aspects, right, of the forearm. So you can actually see those things. It is fun. It is fun. All right. Because they are actually saying things. It's not just ratification. Right. Then there were other cases too. Acne vulgaris, you will be taught how to grade a particular patient, like based on the lesions. And this is different from your other postings because the pharmacology that you're learning, it's not that relevant. All right. Like, yeah, some of the antibiotics you would know the names of, some of the steroids you can recall, but there are other things too, like permethrin. So I don't know if I'm studied properly power or that it's not included, but it's not one of the most important topics as such. And here it is. You should know that it is given in the treatment of scabies. And if you are attending the wards, you will also realize how you have to apply a particular lotion, where to apply. Like they literally take 2 minutes to explain the patient and they ask them to like reply what they have understood. Everything has to be told. So yeah, you learn those things, you learn clinical things. Apart from that, yeah, see cases of you will see cases of scabies. You will learn about circle of Hebra. Yeah. So apart from this, you are going to in scabies, you will learn that there is a particular complaint. Like in TB, there is evening fever and it gets more severe at night. Similarly, in scabies, the itching becomes more severe during the night. So that is a very typical complaint of scabies. Other than that, you will. I have seen, like we have seen, basically a particular 4 to 5 group of kids. They are coming together, and the mother is saying that all of them are having the same thing, and yeah, they all were suffering from scabies basically. So yeah, you when you are seeing the PPT and ma'am is saying, that, you have to ask even the your other family members about this thing. And even in PSM, they teach you that if it is a fomite-based transmission, then you have to take prophylaxis, you have to give. So yeah, that is an actually thing that you get to learn in the dermatology clinics. Apart from that, there are cases of impetigo. Then uh, I guess it was pemphigoid lesion in the mouth. It is very prominent. So even ma'am was taking pictures and she showed us, okay, see these are the type of lesions that can occur in the mouth, blisters. And then there are candida infections, oral thrush, you can see it. Then intertrigo, you can see the small white dots like thing. Um, then then there is also cellulitis case, which you will learn in microbiome that it is positive strep, and it is a bacterial infection. I saw this case in surgery wards. Basically, that patient came for redressing. So yeah, she was literally screaming with pain. Uh, the only thing resident did was remove the band-aid, and that lady was literally screaming like from one room to other room. It could be her. Yeah, that it is that painful.
Oh.
So yeah, there are two. There is eczema, which is very important. Atopic dermatitis, seborrheic dermatitis, even contact dermatitis. Sometimes it could even happen that the patient has nothing, but just because they are very concerned, they will come. Even the doctor is saying कि नहीं है कुछ भी, फिर भी ठीक है, रहता है.
Okay, so it seems that you are very, very passionate about dermatology. So, guys, but I would like to summarize some of the points that you should initially start with basics. It's not that whatever she has all told you need to diagnose at all, but you should be able to diagnose basics like what type of lesion it is and all. You should always start with basics, and that is only important for you at your level, and then uh, you can build on that and you can learn more and more important things. Secondly, you as you could hear from her that there are so many things to see and learn in dermatology, so it's totally not at all a waste of time, or it's like you shouldn't go to dermatology wards if you wish to learn, if you wish to see. It's really very clinical and you will get to learn a lot. Like as she shared, whatever we tend to see or hear or read in dermatology, whatever, like as she told that she saw a case of scabies in which 5 children had scabies. So we have read that in scabies that it occurs in families, it occurs in other family members also, and that you literally tend to see whatever that is written in the books, you are able to see. So it is very clinical subject. So you could learn if you wish to learn. So coming back to it, so Jagruti, can you tell us what are procedures are there which can be seen?
The one you need to know is KOH mount, 10% KOH mount. It's not, you have learnt about it in microbiology, parasitology के करता है, and fungal infections के लिए करता है. You will be able to see it here. Do make sure that you see here because microbiology के practicals में they are not going to conduct it. All right, they are not going to perform it. So this is the only place where you can learn it. The other thing is wood lamps. You will see it in the cases of vitiligo. In vitiligo, the man told us that you basically compare the color of your nail along with that of the color of the lesion. And if it is white, then it is the case of vitiligo. So yeah, that is one thing. And apart from that, you learn normal things. कि हाँ dermatophytic infection होगा तो उसके अंदर you will see like for instance any TSS vesicular you will see some kind of color. Yeah, that is a very practical point of view. We were able to correlate well dermatology because during our clinicals, we had this skin and soft tissue infections going on in microbiology. So we were able to compare well. But if you have studied the chapter and or if you have subscription to Marrow or Prepper or Dance, then you are most welcome to see that they have covered the points and you will be able to see in the practicals as well. Yeah. And yeah, there is diascopy too, which is done. And you will even see them conducting the hypersensitivity test. They literally make them sit for a few minutes and then they check कि हाँ कुछ आया है कि नहीं आया है, where is the rash है नहीं है, they check. And हमारे सामने दो तीन patients को they have filled the form of that multi-drug resistance. कि, yeah, don't give them this, they are allergic. You will see that.
Okay,
That
so
practice.
guys, that is very important point that whatever you have studied in microbiology in the skin and soft tissue infections, then if you weren't able to correlate that much in microbiology, then here practically you would be able to see those things, those investigations being done. So it's not just a theoretical thing. Those tests are actually being performed, and you actually could see all those things whichever is written in the book in microbiology.
Yeah, they are going to show you under the microscope if you ask them like particular slides. If you ask them, they will show.
Okay. And yeah, as far as I also remember my posting, then probably they also show you Zn smear, in that they do cold staining, right?
And yeah,
Yeah. So that
yeah.
also you could see there. Uh, so there is a lot to see basically. So coming back to it, so Jagruti, please tell us what is asked in the exam of dermatology and how to prepare for the same.
See, when we went to the row examination day, I shouldn't say this, but yeah, ma'am came to us and ma'am said, okay, if you have read it, well and good, mark it. But if you haven't read it, kindly leave the space blank. We will fill it for you because we have to pass. But if you are dedicated, you will be able to answer most of the questions. And yeah, you can refer this book named by Nina Khanna, Illustrated Synopsis of Dermatology and Sexually Transmitted Diseases. In every chapter at the start, there is contents, and even in that, she has marked the questions which are must know and which should be known. Don't have to know the details, but you can still like have an overview. If you don't have other subscriptions, then yes, you can read it from the book. It's a very thin book. It is easy to understand. But if you have the subscription, then yes, cover those few lectures during the clinical questions. The notes are more than enough.
Okay. So I hope any of our resident doesn't see this, and especially their higher faculties doesn't see it. I hope so. So basically, our dermatology
Yeah.
department is like a coconut. They are very, very strict in terms of everything, discipline and all. But at time of exams, they are kind of lenient as well. Yeah, so
Yes.
that's all about dermatology. Thank you, Jagruti. And guys, there is a good news. She is going to stay with us for psychiatry clinical postings also. So she will be there for our next video as well. So subscribe to my channel. Stay tuned. This is me, Yash Gandhi, signing off.